Hello, my name is Trina Miller, and I am the perinatal nurse consultant for the Department of Public Health. I am excited to share with you about the 17P Prematurity Prevention Project, which is a result of a grant DPH received from the March of Dimes. First, I would like to share with you some prematurity data from the March of Dimes peristats. As we can see in the graph, in 2007, the preterm birth rate was 12.7% of the live births in Kentucky. We can see a downward trend until 2016, when the rate slightly increased. In 2017, the rate decreased slightly to 11.1% of live births, which represents 6,092 preterm births in Kentucky for that year. That means 1 in 9 babies was born premature in Kentucky. In an average week in Kentucky, 1,076 babies are born. Of those, 117 babies are born preterm, 84 babies are born late preterm, and 16 babies are born very preterm. But we can help to prevent preterm birth, and that is another reason why we are excited about this project. Let's look further at the terms of pregnancy. ACOG has updated the definitions for terms of pregnancy. A preterm birth is one that is before or prior to 37 weeks gestation. An early term birth occurs between 37 weeks and 0 days to 38 weeks and 6 days. A preterm birth can be completely unexpected, and these babies are much more likely to become sick. In fact, the earlier a baby is born, the more likely it is that he or she will have health problems. If we look at what a full-term birth is considered, this is 39 weeks and 0 days until 40 weeks and 6 days. Babies born between 39 and 40 weeks of pregnancy have the best chance of being healthy. This is why it's important to have a full-term pregnancy. Full term means your baby is born between 39 and 40 weeks. During the last few weeks of pregnancy, important organs such as the baby's brain, lungs, and liver are still developing and growing. At 40 weeks, the brain is more developed and more circuits and connections have also developed. The size of the brain grows and develops to almost double the size from 34 weeks. Now let's look at what preterm labor is and what can be done to prevent preterm birth. Preterm labor begins with contractions of the uterus before 37 weeks of pregnancy, causing the cervix to thin out and open up. Progesterone is a hormone that helps your uterus grow during pregnancy and keeps it from having contractions. Progesterone is shown to decrease inflammation and to block the effect of oxytocin on the myometrium to keep the uterus from contracting. Preterm birth occurs when preterm labor could not be stopped. 17P is the form of progesterone given intramuscular for prevention of preterm birth. It may be referenced as 17-alpha or hydroxyprogesterone caproate or 17-OHP. During this presentation, I will be referring to this form of progesterone and will refer to it as 17P. A second form of progesterone is vaginal progesterone. This form of progesterone may help reduce your risk for premature birth if you have a short cervix and are pregnant with just one baby. Vaginal progesterone may be prescribed by a healthcare provider if the woman has a short cervix during an ultrasound. The cervix is considered short if it is less than 2 centimeters long. If she has a short cervix, it may open up too early before the baby is ready to be born. When the cervix opens too early, it is called cervical insufficiency or incompetent cervix. If she has a short cervix, she has a 1 in 2 or 50% chance of having a premature birth. But to note, vaginal progesterone does not work if the woman is pregnant with multiple babies. So as I mentioned, for this presentation and for the 17P Prematurity Prevention Project, we will be referring to 17P or progesterone that is given intramuscularly. It's important to note the pregnancy criteria to know what women 17P will actually help prevent premature birth. 17P may help prevent a preterm birth if the woman meets the following 2 conditions. First, if she has had a prior spontaneous premature birth when she was pregnant with just one baby. Spontaneous labor means that labor began on its own without medications or other methods, such as the bag of water was not broken early. Secondly, she must be currently pregnant with just one baby. Progesterone shots do not work if the mother is pregnant with twins, triplets, or more than one baby. If the pregnancy criteria is met, the prenatal provider may prescribe weekly 17P injections. The injections should begin between 16 and 24 weeks of pregnancy. They will continue until the 37th week of pregnancy or till the woman delivers. For late prenatal care, injections may begin up to 23 weeks and 6 days of pregnancy. Women should be encouraged to talk with their provider about safety and side effects of progesterone injections, or if they have questions. The woman may experience some discomfort at the injection site. 17P is safe for the baby if the injections are given in the 2nd and 3rd trimesters. Now I'd like to share with you more details about the 17P Prematurity Prevention Project. As I mentioned, Maternal and Child Health of the Department for Public Health received a March of Dimes grant for this fiscal year, FY19. The grant is funded by the Anthem Foundation, and funds are used to purchase materials for local health departments to distribute to pregnant women. We will also utilize pre- and post surveys to determine knowledge of local health department staff and providers. The purpose of this project is to increase awareness and use of 17P to reduce preterm birth for women of childbearing age who have a previous history of preterm birth. The goal is to identify pregnant women with a previous preterm delivery and to provide pregnant women with a history of preterm birth with 17p information by the projected 15th week of pregnancy. These are screenshots of the material that are included in the 17p educational packet. All materials are bilingual and contain an English and Spanish portion. The first one you see on the far left is the health action sheet, Are Progesterone Shots Right for You? This is downloadable from March of Dimes, but an individual color sheet is available and included in each packet. One side is in English, the other side is in Spanish. This is a very easy read material with a checklist so that women can see if they would be eligible possibly for progesterone shots. The middle screenshot is the table of contents from the March of Dimes prenatal care booklet that is included in the packet. And to the far right is a small handout with one side in English and the other side in Spanish about 17p. So let's walk through the process of the project. Step 1. Local health departments should give all pregnant women the packet of 17p information. If the health department needs more materials at any point, please let me know so that I can provide you with more of these packets. The woman should receive the packet prior to her 16th week of pregnancy, if possible. The 17p packet can be given to her at the local health department, or it can be mailed to her. It will have prepaid postage on it. A suggestion is often the PT1 pregnancy test form is utilized at the pregnancy test. And if you would like, you could write in the projected date when her 15th week of pregnancy begins next to the EDC and indicate at 15 weeks gestation. Or you may want to track this by your own methods. Another suggestion could be to place a sticker of those patients who meet the criteria on a piece of paper to create a log. Then you could write down the date when the woman would reach 15 weeks gestation, and then also write down the date when she is mailed or provided the packet. It is important that we do track the number of 17p packets you hand out to pregnant women, or the number of pregnant women who receive this packet. Now let's spend a few moments talking about the pregnancy wheel and how to identify when a woman reaches that 15th week of pregnancy. Each health department should have received a pregnancy wheel like the one pictured in the presentation. You will see on the movable inner portion of the wheel there is a solid red arrow, and this should be placed on the first day of the woman's last menstrual period. You would then look to find the number 15 on the edge of the movable wheel. When you find the number 15, then look at the months listed on the border of the wheel and see where the number 15 lines up with. This will be the month and day of the beginning of the 15th week of pregnancy. Let's try an example. If the first day of the last menstrual period is January 5th, then you would line the solid red arrow up to January 5th. You would look for the number 15 on the edge of the movable wheel. Then look above that, and you will see that the 15 lines up with April 19th. April 19th would then be the beginning of the 15th week of her pregnancy. Once again, we want to be mindful that it is best for the woman to begin the progesterone injections, or 17P, beginning at 16 to 20 weeks of pregnancy. Step 2 is to complete the 17P pre-survey as soon as possible. If you have not already completed that, please do. And this is the link. If you have any questions, please contact me. Step 3 is then to send the survey link to any of the contracted prenatal providers that the health department works with, or other prenatal providers the health department makes referrals to within your county. You may work with providers outside of your county, but it is likely that a health department within that provider's county will also contact them with this survey link, and we do not want to send it to them several times. So please contact those that are within your county. Another option, you could also ask me for a Word document of the survey, and then you can fax that to the provider and then ask them to fax that back to you or to myself. If you do the fax method or the Word document method, I then need to know if they have that, return that to you so that I can track that number. I will not need to have you inform me if you've sent it to them electronically, as when they complete the electronic survey, I will receive that information directly. Step 4, complete a 17P post survey that I will send you electronically in early June. Please forward the survey to prenatal providers, as I referenced a few minutes ago in step 3. This survey should be completed by June 14th of this year. Step 5, I will follow up with each local health department by June 14th to ask for the number of 17P packets given to pregnant women. I may intermittently check with you to see if you need more materials or to see how many packets have been distributed. But always feel free to contact me if you need more packets. Maternal and Child Health thanks you for providing pregnant women with important information that can help prevent preterm birth in your community. This is my contact information if you have questions. I can be reached at 502-564-2154, extension 4406, or by email at trinam.miller@ky.gov. Thank you.